Good morning, and thank you for joining us for this month's Wednesday webinar. I'm Allison McDermott, Reference Services Librarian and Liaison to the College of Arts and Sciences. And today we'll be discussing the Joint Commission databases that are available within the UAGC library. So here's what we'll be covering in today's presentation. This includes an overview of the Joint Commission, as well as why it's so important to students. And then we'll also go over the two databases that we subscribe to, the eDition and the Source, and how to access those and find those within the library. And we'll also be sharing some resources that we've created to help students use these databases. So let's begin by looking at the Joint Commission. For those of you who might not be familiar with the Joint Commission, they are the nation's oldest and largest standard-setting and accrediting body in healthcare. Their goal is to improve healthcare for the public in collaboration with other stakeholders by evaluating healthcare organizations and providing guidance on how to provide safe and effective care of the highest quality and value. They certify more than 22,000 healthcare organizations and programs in the United States each year. These accreditations are good for 3 years, except for laboratories, which are good for 2. The Joint Commission accreditation and certification can impact the healthcare organization's access to funding and dictate what insurance can be accepted. The process for accreditation involves an unannounced visit from a Joint Commission surveyor who will evaluate the healthcare organization according to their accreditation and certification manual. So the library subscribes to 2 Joint Commission databases or resources, the first one being the Joint Commission eDition. Now, the eDition provides students with a digital version of the accreditation and certification manual that the Joint Commission uses to evaluate healthcare organizations. The manual is updated regularly, which is reflected in the database, so students and faculty have the most current information available. It is currently being used in the following health information management and healthcare administration courses. And I emphasize currently because I know courses are currently being revised. The Joint Commission may be added to additional courses, or it may be removed from these courses. So as of this moment, these are the courses using this particular database. We also have the Source. Now, the Source is the Joint Commission's newsletter, which provides accrediting and certification compliance strategies for hospitals and healthcare professionals. The publication contains a blend of compliance strategies and solutions, news, and infographics. Published monthly, the library carries the current 10 years worth of newsletters, so from 2013 to the present, and it is currently being used in the following health information management and healthcare administration courses. So you might be asking yourself, why is this so important to students? Well, students are required to use the Joint Commission resources to learn about their importance to the healthcare industry, which is their future profession. Students are introduced to the Joint Commission in their first course, HCA 205, but many of the classes throughout the BA HCA and BS HIM programs require students to apply the regulatory concepts to the work they are creating, which reinforces the importance of the accrediting body. The standards were created to ensure patient safety, delivery of high quality care, and the safety of all employees in the healthcare industry. Additionally, students learn the importance accreditation has on whether the organization is eligible to see patients whose care is paid via Medicare and Medicaid funds. So if they do, a hospital healthcare organization does not get accredited by the Joint Commission, they cannot receive patients who use Medicare and Medicaid, which is a huge chunk of the population. So this is extremely important. And again, this influences the financial stability and longevity of the organization. So now that we've gone over what the Joint Commission, what it is, and the resources available in the library, we're going to go over how to access and search these databases in the library. I'm going to escape out of my wonderful PowerPoint, and we're going to go right to the library homepage. So to get to the Joint Commission databases from the library homepage, you're going to want to select Find Articles and More, Databases A to Z, and then from the A to Z, the Jump To section, you're going to want to select the letter J. And then there you have the Joint Commission edition and then the source. We're going to start off with the edition. Oh, for some reason it already defaulted to what I was looking at earlier. So let me get out of that. There we go. So this is the homepage for the Joint Commission edition that provides you access to the comprehensive accreditation and certification manual. You can search the database by using the navigation bar in the left portion of the screen. It automatically defaults to the most current version of the manual, but you will have access to the last two versions as well. To access the manual, you'll want to select accreditation requirements right underneath standard manual content. And that will open up a drop-down menu with the different accreditation requirements, and there are 18 total. If you are interested in looking at one of the particular requirements, you'll just want to select the text. And for this demonstration, I want to look at medication management. So a new page opens with the standards for this accreditation requirement. At the very top, you'll find some general information about this requirement, including an overview. And I always think this is really great for students to look at because this overview explains why this is so important and other really useful information about this particular requirement. There's also information about this particular chapter, information you'll learn, as well as a chapter outline. That includes a breakdown of a couple words that breaks down where you'll find information in that particular standard. Below are the actual standards. So as you can see, for medication management, there are a lot of standards. You are interested in looking at a particular standard, you will select the little arrow right next to the standard label, and that will expand. Right above, you'll find information about standard introduction and rationale if available. I've looked at some of these and sometimes this just isn't available, but luckily for this particular standard it is. Below that is where we're going to get into the meat and potatoes, and this is the elements of performance. And these are statements detailing the specific performance expectations that must be in place for the organization to provide high quality care and services. So these are what needs to be met in order to pass the standard. And right next to that is the CMS crosswalk, which provides a visual illustration of the alignment between the accreditation standards and the Center for Medicare and Medicaid Centers conditions of participation for hospitals in Medicare. So I know that's quite the verbiage there, but this explains how this aligns with the Center for Medicare and Medicaid Services. For more information about this, you can just select those links and a pop-up window will open up. And that explains how this requirement and how the Medicaid requirements correlate. Right next to that, to the right, you will see if it's a new or critical EP, it will be marked as such. And further over, you can see how you would demonstrate compliance with a particular standard if applicable. This could include focused standard assessment, if whether or not documentation is required, or early survey policy options. If you don't know what any of these mean, or you're unfamiliar with them, because a lot of students might be, you could select those links right there, and that's going to explain to you what focused standard assessment means. There is an option to print the standard or have it downloaded to your computer as a PDF using the print option. If I just select print and then select print again, I can just save as a PDF. I also have the option to email it to myself if I prefer. There is an option to even print or just download the PDF, the entire chapter as well. If you are interested in viewing the most current, because the manual gets updated regularly, if you're just interested in seeing what's new, there's an option to limit that way by going up into the blue banner near the top of the screen. And you can select that link, and this will provide you information about what is new in this particular version of the manual. There is also an option to filter, and this can be very useful for students as well. So if they just want to filter just to the new changed EPs, if they need to focus on patient safety for an assignment, they can filter to patient safety, or even the focus standard assessment, whether one of the standards needs documentation or early survey policy. So there's a way to filter the information as well. For more information about the accreditation process, you can click on the accreditation process info link. And here you'll find more information about the accreditation and certification process. Lastly, you're also provided access to a glossary. So if you ever run into a term, which I'm sure students happens to them quite often, in the manual that you're not quite sure about, you can always just look it up in the glossary. Because I've noticed when I was looking through the manual, a lot of acronyms are used. So adverse drug event, ADE, adverse drug reaction, ADR. And that is the Joint Commission edition. From here, let's just jump right into the source, which is right here. And hopefully it behaves for us today. Okay. So this is the homepage for the source, the Joint Commission's newsletter, which provides accreditation and certification compliance strategies for hospitals and healthcare professionals. The page automatically defaults to the latest version of the newsletter, so October 2023. But you can jump to any volume or issue that we have over in the left portion of the screen under available periodicals. We can see that they're all really well organized into folders. So if I wanted a newsletter from 2020, I would just select the folder. And those are my options for all the newsletters for 2020. As you can see, these newsletters, they can be kind of long, anywhere from about 20 to 25 pages. There is an option to do a keyword search, because I know many students are asked to find articles about a specific topic in the source. So what you would do is you would just go up to the keyword search. For this example, I'll just use hospice. Select search. And this is going to provide me all of the newsletters that either mention or have full articles about the topic hospice. As you can see, it defaulted to the most current newsletter that discusses this topic. But if I wanted to look at other newsletters, I have the option to go into the folders. Since these, newsletters are kind of long, students should look through the newsletter really quick just to make sure it has the information that they're looking for and it's not just mentioned, but it's a full-on article. One of the ways to do it is to do a Control F. So then I can do a hospice. And I can see it's mentioned a fair amount of times. So this would be a good option. There we go. So you can download the PDF by using that icon right there or print it out. And there is also an option to email it to yourself as well. And there you have the Joint Commission, the source. So let me get back into my PowerPoint really quick. So here are some helpful resources you can share with your students on how to access and use the Joint Commission databases. This includes the tip sheet on the eDition and the source. And we also have tutorials as well, made for both databases. So if you have any questions about these databases, we are happy to answer them now. Or if you're anything like me and end up having questions later on, feel free to email them to us and we will respond as soon as we can. And I see there's some chat. Oh, perfect. Thank you, Kira.
And Allison, I think we mentioned this at the beginning, but just in case anybody missed it, or if anybody's listening to the recording later, if there's ever any issue that faculty hear about from students with accessing the source or anything like that, what should faculty do or students do?
That is a great question. They should just reach out to the library.
Okay, I'll drop the library email address in the chat.
We will be on it, we promise.
Allison, we did get a question in the chat from Dr. Branda, and she's asking, where are the resources that I just posted in the chat? Where are they located? How can students find them?
Kira, remind me, are they on the library's homepage? I don't believe they are.
Have we created an HTML announcement for this resource?
I believe we have. Okay. It might not be updated, but we can.
I can check real quick.
Okay. Yeah, that's a good question. I think we're currently hiding our Joint Commission resources.
Well, actually, wait, let me share my screen really quick.
That was a great question, Dr. Brenda, because it might have uncovered that we are hiding them from people.
So
now there you go.
The database, there's the question mark, and that gives the tip sheet, but we probably should put in the
and I bet
well,
it doesn't look like we have an HTML announcement for these on the HTML announcement page.
Well, looks like
we might have one elsewhere. Yeah, we should add it to there. And I bet there's a quick answer for it, right?
There is a quick answer for it. Yes,
that's
there definitely is. So
I can find the link for that real quick.
Thank you.
Got it up.
I would just say, I need to double check. I mean, I just taught a class that uses this, so I should know this off the top of my head, but I do not. It would be helpful. We could just post it in class somewhere, like in an announcement or in the resource section, something, unless it's one of those things that changes a lot, then we probably wouldn't be able to embed it in the class, but we could maybe have it populate as an announcement in the courses that use this resource.
That's a great idea. I don't think the resource changes too much.
Yeah.
They stay pretty consistent.
Okay, because that way all the students know where to find it, and because we have so many associate faculty too that sometimes they don't know where to go, and we could probably just have it as a regular part of the course announcement, like we do with some of our other announcements.
Absolutely, that is a great idea. Thank you.
Anything to help with the Joint Commission stuff.
Yeah, I think we can. I'll go ahead and speak for the library team and say that when we send out the recording, that we can have the updated HTML announcement included in that email that we send out to you, and that way you can use that for your courses.
Yeah, and
that sounds great.
I'll share that with. We can share that with the rest of the team in case other. I know a couple of courses that fall outside of HIM use it. They're shared courses. That are part of the HCA program, but there might be, I'm not sure if the MPH program uses Joint Commission, or I know Gwen's on the call, or nursing, but we could, we also have a resource hub for students. I'm going to write all this down and hopefully I'll remember to take action on it. Yeah, to embed it in our courses.
And we appreciate you so much, Darla. Thank you.
Well, I just if it's one of those that we could already populate, that's one less thing we have to remember to do.
Right.
and doesn't fall through the cracks that way. And then what was the other, oh, to put it in our resource room.
Mhm.
Yeah. We have a student resource room that I think, and it might be there already. Cause that is something that I know Lynn Trevisan was working on, and so she's real aware of the problems we've had with the Joint Commission, but it's a great resource.
It is
because
a great
I-
resource.
Yeah, it's really relevant to what they'll be doing. Okay.
Awesome. This has been great. We have any other questions? I'm happy to give you guys a half an hour back to your day.
Dr. Moore says that should add Joint Commission to the nursing research guide. So maybe you guys can
Oh,
talk
yeah,
offline about
absolutely,
that.
Gwen. I'd
Yeah.
love to.
Yeah,
Thank
great.
you. Yeah, that's a great place for it.
Yeah. This is one of the reasons we love to do these webinars, is because we have a wonderful opportunity to connect and find out how we could be helpful to faculty and make sure that you guys are getting what you need out of these databases. That's the whole reason why we have these. So it's great. Thank you.
You guys
Right.
rock.
Writing all this down.
Excellent.
Yes, I have my little post-it note of things to follow up on.
Love
So
it.
you feel free to reach out, and make sure that I remembered. because-
And same here too. We will get that HTML.
Yeah.
in
Hold
there.
each other
Yeah.
accountable. That's
If
good.
we have it in locations and we don't, then it's just, we don't have to, it's one less thing we have to remember to tell students, because the faculty, I think, get a fair amount of questions from students.
Mhm.
Everybody's kind of all over the map and not knowing what to do, and we end up repeating ourselves a lot. So if we could have it where it's front and center for students, because they, it's frustrating for them when they can't find what they need, and they're usually working at midnight and where the rest of us are asleep and things like
Yeah,
that. So,
absolutely, absolutely. Get
Yeah.
this front and center, get this into the students' hands and.
yeah,
Yeah.
yeah. And then I learned too some really great ideas on some of the filters. I just know exactly what I need, so when I pop in, I go right to what I need.
Yeah.
But it was nice to see some of those other features. Honestly, I've never noticed them. I just go,
Oh,
I just
yeah.
zero in on what I need, and I've never paid attention to some of those other features. So it was really helpful. Thanks.
Oh, you're very welcome. Thank you.
Yeah.
Okay. Well, I think we have our marching orders. We'll get the those resources out to you, HTML announcements, and I think we're all good.
Okay, great.
Thank you for doing this, Allison.
Oh,
Appreciate it.
my
All right.